We've talked about these COVID numbers every night for the last year and a half. Positive cases, hospitalizations, deaths. You've heard from doctors and nurses. They're tired, they're overwhelmed and burned out. But we wanted to know what it's really like day after day, a year and a half into this pandemic. So tonight we're taking you inside the ICU and inside the lives of some of these workers who tell us their anxiety, frustration, and exhaustion don't just fade away when they clock out and leave the hospital. But Dustin Grove learned they are as determined as ever to keep fighting to save lives.
Who's Callie?
Callie, a dog.
Oh boy, is it getting close to bedtime for you?
Our story starts here in the basement of the Willis home on Indy's south side.
Can you make 3 dots for me?
For 3-year-old Amelia, it's playtime with Mom Erin and Dad Brent. All smiles before bed. And Erin is taking in as much as she can, because in just a few hours she'll be leaving for work, where those smiles,
a lot of times at work we just cry,
are hard to come by.
I don't know what I'm getting into. I don't know how many patients we have. I don't know how many people are fighting for their lives. I don't know how many people are going to live that day or die that day.
All right.
Willis is a nurse in the intensive care unit at Community Hospital South. We weren't allowed inside because of pandemic restrictions, but an employee took this video and the hospital shared it with us. On this day in late September, as COVID cases once again climbed statewide, 11 of the ICU's 12 beds are full. Some patients are ready to be moved to other parts of the hospital.
so I have med-surg, no Kelly.
But for now, no beds are available there.
Med-surg has no beds.
That's life now, you know. We're on diversion. Every hospital in the city's on diversion.
Meaning ambulances have to find somewhere else to take incoming patients.
Call me if you need anything.
Here in the ICU, 8 of the 11 patients are COVID positive. That means they're in isolation. No outside visitors. This man is not doing well and wants to call his wife.
This is Lori, your husband's nurse today. We're at that point we're going to have to put him on a ventilator, a breathing machine, because we're having trouble oxygenating him. So he wanted to call and tell you he loves you before we sedate him.
We don't know if it's going to be the last time they're going to be able to talk to each other.
And unfortunately, this is a conversation that we have to have way too often. Something happens to someone that you love, and you just break down. Like, you know, I've held more hands of people dying in the last year and a half than anyone should have to in a lifetime. Sometimes I get mad, I just want to throw things because it is frustrating day after day.
Hey, I was just coming in to be your friend.
Part of Erin's day involves relieving coworkers who simply need a break.
Need anything? What can I do to help you get out of this room?
We're in respirators, we're in gowns, we're in gloves, we're in face shields. It's hot.
But all these patients still need someone.
They can't have a family member in there with them. They're alone. We're it. So we're playing nurse, we're playing family member, loved one, kid, chaplain sometimes, dietary, doctor. I mean, we play all the roles when these patients are in isolation and when they've been in isolation for 10 days and not seen the outside.
Doctors, nurses, and other workers, of course, do get to see the outside. But after enduring these 12-hour shifts day after day, a year and a half into this pandemic, the stress doesn't always go away when they leave the hospital. How concerned are you for your nurses?
Extremely.
Marcus Guajardo is the nurse manager.
I lie in bed awake at night just thinking about what the next day is going to bring. What can I do to help my staff? What can I do to help the patients of the hospital? I know this has taken an emotional toll on myself, and I can't imagine what it's done to my staff.
Do I get smooch?
After a full day at work,
I don't.
Erin comes home to Amelia and Brent.
I definitely see it wearing on her, you know, and way more than I used to. And to see that to the people that you love and care about most, it's terrible.
They offer what they can, the love and support of family.
It's a huge help because I think if I did not have that, I would be in a much worse place.
There's been multiple times during this that I've said, how do we get you out of there? That's her passion, you know, that's what she loves to do.
I work in an ICU, so we have people fighting for their lives every day. As nurses, you know, we learn, we adapt, we make it work, and we continue to come back every day to take care of our patients.
And while Aaron isn't leaving anytime soon, Scott, a lot of nurses apparently are. In fact, take a look at this survey. This is from August from the American Association of Critical Care Nurses. Of the 6,000 surveyed, more than half, 66%, said they feel their pandemic experiences, what they've gone through, have led them to actually consider leaving the nursing profession.
Well, that is a high number.
Yeah.
Did Aaron or anyone else happen to mention how many of those patients were vaccinated?
Yeah, we asked her about that. Of the COVID patients in the ICU that day, she told me none of them had been vaccinated. And that's one of their biggest frustrations. In fact, they say that is their biggest frustration. They feel like if more people get vaccinated, we wouldn't be in this situation.
Yeah, what a great special report. Thank you so much, Dustin.